What it's really like in a mental hospital. When you hear the words mental hospital, what comes to mind? Straitjackets? Locked rooms? Flickering lights and silence. Thanks to TV and movies, psychiatric hospitals are often shown as dark, scary, or even dangerous places. But the reality is very different. In today's video, we'll talk about what it's really like inside a mental hospital, from admission to treatment, and why, for many people, it's a life-saving experience, not a frightening one. This is Mind, Health, and You, where we speak honestly about mental well-being without stigma. Why do people go to mental hospitals? People enter psychiatric hospitals for a wide range of reasons. Some are struggling with severe depression or anxiety. Others may be experiencing psychosis, suicidal thoughts, panic attacks, or episodes related to bipolar disorder, PTSD, or schizophrenia. Going to a hospital doesn't mean someone is crazy. It means they're in crisis and need professional care, just like going to the emergency room for a broken arm. Sometimes admission is voluntary. The person checks themselves in because they know they need help. Other times, it's arranged by a doctor or family when someone is unable to keep themselves safe. Either way, the goal is always care, safety, and healing. What happens when you arrive? When someone arrives at a mental hospital, they're usually welcomed by a nurse or mental health professional. They'll go through an assessment, which includes questions about their mental state, history, medications, and immediate needs. Then, they'll be guided to a unit, often called an inpatient ward, where they'll have a room, meet the staff, and receive a daily routine. Personal belongings are checked to make sure there's nothing unsafe, like sharp items or anything that could be harmful. It might feel overwhelming at first, especially if you're already in distress. But most people find that once they settle in, they begin to feel more secure, knowing they're in a space built for healing. What is a typical day like? A typical day in a mental hospital is structured and focused on recovery. Patients usually have group therapy sessions, where they share experiences and learn coping skills. Individual therapy, where they speak privately with a psychologist or psychiatrist. Medication management, to help stabilize mood or manage symptoms. Occupational or creative therapy, like art, music, or journaling. Time for meals, rest, and self-care, just like anywhere else. There's also regular check-ins from nurses and support staff. You're never alone, and there's always someone to talk to. Contrary to popular belief, it's not all silence and isolation. In fact, patients often form meaningful connections with others who are going through similar struggles. What's not shown on TV? TV shows often portray mental hospitals as places of punishment, dark halls, screaming patients, and harsh staff. But real psychiatric hospitals prioritize compassion, dignity, and patient rights. You have a say in your care. You can talk to advocates, file complaints, ask questions, and even refuse treatment in many cases. Most importantly, the goal isn't to keep you there forever. It's to help stabilize you so you can safely return to everyday life with the tools and support you need. In fact, many stays last just 5 to 10 days. Long-term care is rare and only used when absolutely necessary. Life after discharge. Leaving a mental hospital is not the end of the journey, it's the beginning of a new phase. Patients are usually discharged with a care plan that includes therapy, medication, follow-up appointments, and support services. The best hospitals also help you find community resources like support groups or outpatient therapy programs. Healing takes time, and the goal is to help you stay well long after you leave the hospital. And remember, needing help isn't weakness. It's strength. It's choosing to stay, to heal, and to hope. Mental hospitals aren't perfect, but for many, they are a safe space to pause, breathe, and begin again. If you or someone you know is struggling, don't be afraid to reach out. Help is real, and healing is possible. If you found this video helpful, please like, share, and subscribe to Mind Health in You. And tell us in the comments, what mental health topic would you like us to explore next? You are not alone. And you never have to be.